Hi there and welcome back. Let's review Loeys-Dietz syndrome or LDS. We'll get into the LDS overview. We'll compare and contrast the LDS and Marfan syndrome, causes, how is LDS inherited, diagnosis, treatment, life expectancy that we more are interested in, and ultimately, bottom line, how do we underwrite? LDS is a genetic disorder of connective tissue. Because connective tissue is found throughout the body, LDS features can occur in the heart, blood vessels, bones, joints, skin, and internal organs such as the intestines, spleen, and uterus. Some LDS features are easy to see. Other features such as heart and blood vessel problems need imaging tests to find them. Marfan syndrome and LDS. Some LDS features are also found in Marfan syndrome, and they are enlarged or bulging aorta, the main blood vessel that carries blood from the heart, aortic dilation or aneurysm. Then you may have a tear of the wall of the aorta, aortic dissection, floppy mitral valve or MVP, mitral valve prolapse, chest that sinks in or called pectus excavatum or sticks out called pectus carinatum, then spine that curves to the side, scoliosis, or from the back to the front, called kyphosis. Then you may have flexible joints, flat feet, swelling, bulging or widening of the spinal sac or dural ectasia, or long fingers and toes, myopia, and retinal detachment. Some of the LDS features are different from Marfan syndrome and are very important for making a correct diagnosis. When a person has these particular features, it is important that the doctor think about LDS. The features that set LDS apart from Marfan syndrome and many other connective tissue disorders include arteries that twist and wind or arterial tortuosity, or aneurysms and dissections in arteries other than the aorta, widely spaced eyes or hypertelorism, wide or split uvula or the tissue that hangs down in the back of the throat, or cleft palate, that is when the roof of the mouth is split at birth, or club foot, that is when the foot is turned inward and upward at birth, or white of the eye looks blue or gray, or premature fusion of the bones of the skull called craniosynostosis, or heart defects at the birth such as ASD or atrial septal defect, PDA or patent ductus arteriosus, or bicuspid aortic valve. Features in the skin such as easy bruising, white scars, soft skin texture, and translucent skin, that is when it looks almost see-through, or GI problems such as stomach and intestine problems like difficulty absorbing food, chronic diarrhea. So here what happens, it comes and goes but never really goes away, so that's why labeled as chronic diarrhea, abdominal pain, and or GI bleeding and inflammation, food and environmental allergies, rupture of the spleen or bowel, rupture of the uterus during pregnancy, instability or malformation of the spine in the neck, or cervical spine instability, poor mineralization of the bones that we call OP or osteoporosis that can make the bones more likely to break. Then collection of fluid in the brain called hydrocephalus. And then you can have a part of the brain called cerebellum with an abnormal shape or Chiari malformation. What are the causes contributing to the LDS? LDS ranging from type 1 to type 5 is caused by a genetic mutation in one of the 5 genes that encode for the receptors and other molecules in the transforming growth factor beta TGF-B pathway. These genes are LDS1, transforming growth factor beta receptor 1, LDS2, transforming growth factor beta receptor 2, LDS3, mothers against decapentaplegic homologue, LDS4, transforming growth factor beta 2 ligand, or LDS5, that is transforming growth factor beta 3 ligand, or TGFB3. When any of these genes has a mutation, growth and development of the body's connective tissue and other body systems is disrupted, leading to the signs and symptoms of LDS. Marfan syndrome is different from LDS in that the gene mutation which causes Marfan syndrome is, now we know, we just reviewed before in the prior session, and that is fibrillin 1, FBN1, a protein with the connective tissue in the body. How is LDS inherited? People can inherit LDS, that is, it is passed down from a parent who has LDS. Others have a spontaneous mutation, that is, they are the first in the family to have LDS. To make the diagnosis, the medical geneticist reviews the patient's family health history, conducts a physical exam, and performs special tests which can or may include echocardiogram of the heart, CT or MR with 3D from the top of the head to the top of the legs, and of course genetic testing. Treatment includes continued monitoring using imaging techniques, exercise restrictions, medications, and vascular surgery as appropriate. Life expectancy. More experience is necessary to accurately predict life expectancy for people with LDS. Many patients are first being diagnosed with this condition at an older age. Recent progress in the diagnosis, medical and surgical management of LDS is improving both the length and quality of life for the people with the condition called LDS. So how do we underwrite? As far as underwriting goes, follow your company specifics and the underwriting manual that your company expects you to follow and take that route. Let's take a break here and see you soon. Take care. Bye now.